Hi everybody, I want to share with you a couple examples of rhythmic stabilization techniques or dynamic glenohumeral stabilization techniques that we use in the clinic. This first technique is an open kinetic chain manual rhythmic stabilization technique. We have the patient in the balance point position, which is about 100 degrees of flexion. We incorporate a little bit of scapular protraction to increase activation of the serratus anterior. This is a more aggressive later phase technique that I'm showing here. But we can certainly incorporate these much sooner in rehab by not being as aggressive with our perturbations. We can move more proximally on the arm, so there's a shorter lever arm. We can make the perturbations more predictable to the patient. So again, it's not quite as intense as what I'm demonstrating there. This is an example of a closed kinetic chain rhythmic stabilization technique. So again, we incorporate a little bit of protraction of the scapula for serratus activation, and we're just randomly perturbating the individual, and they're instructed to stay as still as they can to resist those perturbations. And then this is a higher level closed kinetic chain rhythmic stabilization technique. On a BOSU, we've also had the patient close her eyes. So we're shifting the burden or relying even more so on those mechanoreceptors within the shoulder and the upper extremity. This next slide shows some different equipment that we use for dynamic or rhythmic stabilization of the glenohumeral joint. This first technique is, we call it ER oscillation. So you're getting rapid internal external rotation, or the shaky stick is another name that we use in the clinic. You can see there's a red band that is pulling the shoulder into internal rotation. So you're getting rapid oscillating or alternating contraction of the internal and external rotators with this rhythmic stabilization technique, but we can bias the posterior rotator cuff or the external rotators by having that band pulling the patient into internal rotation. This next image is just below to the right there. That is we call it the Statue of Liberty. So now we've progressed to moving the shoulder into a 90-90 position or more of an overhead position, working on dynamic glenohumeral stabilization, again with the band pulling into internal rotation, which biases the posterior cuff. This third technique is ball versus wall rhythmic stave. So just by pushing into the ball, we're getting co-contraction of the rotator cuff, and then we're incorporating these random manual perturbations. This exercise here is a side-lying body blade rhythmic stabilization. We have the shoulder at about 90 degrees. Patient's lying on her side, just doing rapid oscillations of the body blade. That, again, biases the posterior musculature, posterior rotator cuff, because she's fighting gravity. This is a similar standing technique where we have the red band pulling her into horizontal adduction. And finally, this is having the patient in a single leg stance going through a diagonal D2 PNF pattern, which would simulate the throwing or hitting or tennis serve motion, for example. So moving into some sport-specific movements with these rhythmic stabilization techniques using the body blade.